And after that, you can, as always, put in a question. Do mention your age and gender so that Dr. Kunal Patankar can give a considered reply. Over to you, Dr. Patankar.
Yeah, thank you so much. First of all, welcome all the audience, and thank you for the opportunity for me to be presenting a hypertension, a very, very important topic in the field of cardiology across the entire age spectrum, from young age to the elderly. It's very important we know how it is and what goes about with it. Also, I'm seriously very happy to see 178 seniors joining. So the happiness of someone who is a tech enthusiast to see people being so well versed with the new modern technology is so happy. I'm very happy to see that. So without wasting much of your time, I'll just start why hypertension in elderly people is important. Pardon me if I say the term elderly, but this is how you might be young at heart, but the body does age, and so does the mechanism of managing blood pressure in your body too. So what happens as you grow old, and you might be knowing this, and when you have would have read it somewhere, your blood vessels are like an elastic pipe. So when you are young, when you're just born, in your youth, in your adulthood, they have that elastic property. They can expand and relax as per the blood pressure dynamics of your body. As you grow old, something called as arteriosclerosis. There are two terminologies. One is atherosclerosis, which is deposition of lipids, that is the cholesterol inside your blood vessel. That can be blockages or something else. But there is something called a stiffening of the elasticity of your blood vessel, called as arteriosclerosis. In short, what does it happen? Your flexible pipe starts becoming stiff. So now, whenever there are fluctuations in your blood pressure, your pipelines of your body won't be able to adapt. Hence, eventually, it leads to increased hypertension. I'll explain you much better with an example going forward. So what's the crisis? Okay, so hypertension is inevitably, most of you might experience it as you proceed further in your age. But at the same time, treating it aggressively by a cardiologist becomes a point of concern, because a sudden or a significant drop in blood pressure can also cause one of the most feared complications in you. It is a fall. A fall in elderly is one of the most common uh, accident which you guys come across, and fall can lead to fracture, injuries, and then it starts spiraling down. Going ahead. So it has been observed, the LASI study stands for Longitudinal Aging Study of India. It says more than 40% of the people above the age of 65 fall into the pre-hypertensive group, 22 in the stage 1, and approximately 10% in the stage 2. It's like approximate, if you sum this up, more than 50% of the people are are hypertensive, but they are not being treated or are not getting adequate treatment for the same. Now, this was the example I wanted to give you. And now, all of you have done gardening some or the other time of your life. Okay, so we have a normal garden hose pipe, and you see you turn on your tap. So your tap is your heart. It is the pump which is giving a water pressure at certain level. The moment you start pinching the mouth of the hose pipe at one end, you can see the strain. You can see the streaming, first of all, from the end of the pipe. You will see the jet going ahead. But at the same time, if you do it for a long time, it is going to put pressure on the tap or the motor which is generating that pressure. The same happens here. As you age, because of the arteriosclerosis as well as the atherosclerosis, the vessel starts becoming stiff. In that case, if it is not controlled, if your blood pressure is not controlled, it's going to put indirect pressure on the heart, causing it to pump more harder, take more effort, and do that 24/7 all around the day. At the same time, even will cause end organ damage. So what happens if this same example, if the pipe is being uh, facing the same shear pressure or high pressure for a really long time, there will be some microfractures in the integrity of the pipe, or at a certain point, the pipe will burst because it cannot take the high pressure. The same happen if there is a burst of an artery in the brain, then you call, okay, he got a brain hemorrhage. That's why he got a stroke. Or if the high pressure exists at the kidneys, we get kidney disease. So this is how slowly and slowly, without being noticed, the cost of uncontrolled pressure is going to be really high. Sometimes even microvascular strokes in the brain can cause dementia, which is forgetfulness, or a major stroke can cause paralysis. One thing which is not really screened actively, it's about hypertension causes kidney disease. People might say, okay, as you grow old, the creatinine is going to go up, that is accepted, age adjusted, it is okay. No, but you have to be very, very vigilant about keeping your creatinine levels in regards to your hypertension also. If you are hypertensive, you have to monitor a few things, which is kidneys, your brain, your eyes, which is the retina for retinopathies, and most importantly, on heart. And how do you do it? For the heart, you have a 2D echo, which you keep doing screening maybe annually or once in 2 years, just to see how your heart is behaving in response to the hypertension, which is control or uncontrolled. That can give you a good idea. At the same time, the kidneys can be evaluated by doing serum creatinine and USGs if needed. Now, these are one of the important slide I wanted to share with all of you. It's breaking the barriers. Like we come across people in the OPD having myths, and it's always the myths which causes more damage rather than the facts. Because myths are incomplete facts. People believe it and then they follow it. So going first myth, which is inevitability, uh, we get people in the OPD saying, okay, I have lived 85, that's it. Now disease is going to come. It is inevitable. I would like to tell you, aging does not equal to disease. If you start normalizing aging is equal to disease, then it becomes very difficult, first, to have compliance, second, to keep you motivated, and third, to make you understand that you can continue to have a significant good quality of life what you had 10 years before, also even 10 years later. But that resistance has to break if you break the myth of inevitability. Second, symptom dependence. Now, people do not actively, especially in the Indian setups, they do not actively screen themselves. There is no culture of screening ourselves. Let's get ourselves tested. They feel uh, being fine and having no symptoms, maybe no headache, nothing at all, living a good life is equal to being safe. That's not the case. Even if you're having the pink of health, it is always important you get yourself screened. That is the essence of a screening test. Why do you screen? So that you can catch all the problems way before they start creating damage, which is irreversible. The third, and it actually irritates us and as cardiologists the most, is curative regime. And this goes not only for hypertension, it goes across all the spectrum of long-term diseases. And let's have a little more emphasis on this point. See, when you have a cold, cough, and fever, your doctor prescribes you a medicine for 5 to 10 days. Okay, that is a course. Do not treat your hypertensive medicines, diabetes medicines, thyroid medicines, and even for the sake cholesterol medicine as a course. If after taking any of these medicines, you get a superior control or a good control over your hypertension, your diabetes, your cholesterol, and even your thyroid, that means that the medicines are working along with your definite lifestyle modifications. But that does not mean it gives you the freedom to stop the medicine at will without any consultation. The normal example which I give to my patients in the OPD is like, you are in the eighth standard, you studied 18 hours, you got rank one. Now you're in the ninth standard, you did not study a single day, you did not put in the effort of studying 18 hours, and then you expect yourself to get rank one. It's no. So that is how your blood pressure, your cholesterol, your diabetes, all is controlled because of the medicine in hand with your obviously lifestyle and dietary modification. But you cannot treat these medicine as a course kind of a thing, which we do for common cold and all that thing. Second, isolated sodium. So we get, सर हमने डॉक्टर हमने नमक बंद कर दिया है. No, नमक बंद कर दिया है is one of the good things which you do, but there are other food materials in your kitchen, preservatives. For example, papad, pickles, all the processed food need preservation by salt. So they are highly sodium containing products. What does sodium do? Sodium directly absorbs excessive water from the kidneys, eventually leading to a high blood pressure inside your body. So what does that mean? Does that mean stop having salt at all or start having bland food? No. Have the salt which is there in your food. Avoid table salts, avoid processed food, avoid anything which is preserved, stored, because any preservatives in India requires two things. First is salt, the other is sugar. Out of these two, none of the preservatives are available, I think so. Okay, so the dash, you can Google it or Gemini it, and I think you're quite technically advanced, so you can use the AI. Is dietary approaches to stop hypertension. It tells you that you decrease your sodium intake, and at the other end, you increase your potassium, calcium, and magnesium intake. This can be via medicines, by supplementations, or by having potassium-rich fruits, which can be kiwi, banana, etc. So what it does, it potassium helps you to remove sodium from your body. At the same time, it relaxes your blood vessels, causing them to relax and get down your blood pressure. So how much salt you can take per day? So it's 2 grams, which is 2,300 milligrams. And for hypertensive patient, it has to be 1.5 grams. So now measuring it by grams is the new number which has been given by American cardiology. But one teaspoon is enough for your entire day's quota of having a salt. Again, the fact which I wanted to come back, eat a healthy heart does not mean you abandon eating traditional food. No, moderation is the key. So you can increase complex foods rather than highly processed foods. Avoid oils. In short, you will avoid cholesterol. In short, you will avoid atherosclerosis, which can uh, further lead to stiffening of your blood vessels. Rest a balanced diet, as everyone, all of you know, 30% carbohydrate, 30% of protein, and the rest 30% of fats, and then 10% of fiber is a good diet for everyone to follow. Now, this topic, this part, I wanted to specially cover because it was not covered in our topic, and um, I think it has to be addressed because many of the people are into the Ayurveda and home remedies. So I would like to add a little touch on this part. So Ayurveda and allopathy, I've observed that it does coexist in our geriatric population, in the elderly Indian senior citizens. It's not much in the younger people. They are more of allopathy. But my parents and my bade papas and all that, they still are more inclined toward Ayurveda. So the problem is Ayurveda is effective, okay, but then it has to be known. Let's break it down to as simple as possible. Whatever you take during an Ayurveda, which are made of herbals products, eventually you're taking active ingredient of that crop, of that leaf, of that root, and of that herb. So that active ingredients are chemical components. Those same active ingredients are used or molecularly mimicked to make the medicines of allopathy. So you cannot have both of them having them together. You just don't combine allopathy and Ayurveda together. That's going to be dangerous. And I'm going to give you two examples. I think because this is the most used Ayurvedic drug, which is ashwagandha. So yes, it is known to have a fantastic effect. It is a stress modulator, as we've been known since ages in our books also from the ancient times. Neuroprotection, it enhances immune response. All these are true. All these have been proven. But at the same time, you should know that there is an enzyme in the liver known as the P450. Now, this enzyme is responsible for even modulating the allopathy medicines which you take. Sometimes decreasing the P450 enzyme modulation can increase the effect of the other medicine, or increasing can decrease the effect of the medicines. For example, if you are on ashwagandha and if you are on blood thinners or any cardiac medicines, now this can happen. So if ashwagandha modulation speed ups the enzymes, here I'll just use the laser here for you. Yeah. So what does ashwagandha in the liver can cause a speeding up of the enzyme. So whenever you take blood thinners, especially warfarin, which is an anticoagulant, especially people who underwent valve transplant or had a stroke or recurrently have stroke, then the warfarin dose is going to be subtherapeutic, because ashwagandha is going to speed up the liver utilization of warfarin. At the same time, if you're going to have digoxin in your body, which is again for an abnormal heart rhythm or people with atrial fibrillation, it's going to slow down digoxin clearance from your body. Eventually, it's going to lead to piling up of digoxin in your system, causing digoxin toxicity. So again, the key is not to scare you of using Ayurveda and allopathy together, is to know how do they both interact with each other. That is important. Again, now forget ashwagandha. Normal concept about garlic and turmeric in your own household remedies. So yes, it has been proven that it has lower lipid lowering uh, properties. It is a mild antihypertensive, as not as effective as allopathy, but definitely, and it has an anti-inflammatory property. Agreed to all that, but it also has a potent platelet aggregation inhibition property also. What does that mean? Okay, having garlic every day, people have garlics every day, can by default cause decreased platelet function. And at the same time, if you have underwent an angioplasty or you're on blood thinners like ecosprin and clopidogrel, it is going to enhance the effect of these two medicines also. So eventually, you're causing a synergistic effect. So your bleeding tendency increases. And why am I more worried about bleeding tendencies in the elderly? Because it can be then again a source of blood loss, causing anemia, causing again weakness, and again some leading to frailty. So this was a topic which I wanted to cover, which was off the shoot of off our track of hypertension. But this is an important topic. I thought I should share it with all of you. The next topic, which I think at present we have crossed this stage of post-COVID, how and what were the effects of the body, and if you've suffered with COVID, and how it is going to interact going ahead. So something called as post-acute sequelae. In the acute infection you have suffered, which was during the COVID period, if you've been hospitalized or had just COVID positive, the studies have come out that yes, effects do last, especially on the cardiac events, cardiac parameters over a few years. The mechanism is the virus attacks the ACE inhibitors. That is too much technical for you, but these ACE inhibitors are very important receptors on the heart muscle as well as the blood vessels. So what you can find myocarditis, which is inflammation of the active heart pumping. Pericarditis, it is the covering of the heart. Electrical imbalances or electrical instability. You can have abnormal heart rhythms and symptoms. But I believe, sir, if you have uh, had COVID before, and it's been 3 to 4 years now post COVID, and none of these have occurred to you, I think you should be rest assured that you have faced through that phase. I think you have sailed through that danger area where if this would have been a great topic, if you would have been in the year 2023, 24, we are in 26. So it loses a significance right now. Unless and until a population of our attendants and the audience have suffered microclots and had DVTs, which is long blood clots in their leg, which are migrating to the lung or to the head and cause heart attacks, then medicines, I think you might be on medicines, antiplatelets and anticoagulation, and you need to continue them. One more thing which has been observed post-COVID is people who have suffered COVID had a significant toll on their bodies, and now they feel fatigue a lot more faster as compared to their peers who have not had COVID. So there's something called as post-exertional malaise. This happens when your body goes through an extremely stressful condition and then you recover, and post-recovery your energy level is really low. And if you wanted to have some takeaways from this point, so like what should be the points of immediate care? Forget the COVID part. If you have sudden unprovoked chest pain, or if you have breathlessness while lying flat, or you have sustained tachycardia, which is you can feel your heart rate running really high. This can be one of the few red flag signs that you might be having post COVID cardiac symptoms. But again, as I said, this would have been very important in the year 2023, 2024, not at present. Okay, now the aging defense. Okay, understanding what is immunosenescence. Immuno is your immune system, senescence is growing old. I'll make it as simple as possible. Uh, when you're born, you get the innate immunity and the active immunity. So, and as you grow, you're exposed to multiple allergens and you get ill, you get fever, your body is strong enough, it senses all the bacteria, makes antibodies against them. So it is kind of an industry with a fantastic CEO with talent density. So if you get pneumonia, you will have army of white blood cells who knows this specific pneumonia, how to destroy it and how to get rid of it. Now, as your body as an organization grows old and you start aging, and the CEO also grows old and the management also grows old, so the talent density starts decreasing. So now you have mass recruits. What happens? Your body starts making uh, novice or immature cells just to fight against infection rather than specific military, super specialized army force or military corps. So, in that bargain, to protect you from the aging, to protect you from the infection during your elderly age, your body produces more of cytokines. Maybe cytokines are the body defense mechanism to fight against bacteria, which are not so well specialized, but it will treat as a generalized fighting body against any antigen, maybe a bacterial or a viral or fungus, but they won't be specific enough as they were specific 30 or 40 years back. So what's the bargain? You lose the highly specific uh, white blood cells in your body, which are the well trained Navy SEAL, and you get a normal recruit of new recruits. What happens? The WBC cells and the pro-inflammatory balance of your body increases a lot. So slowly, your body starts moving paradoxically in a mild inflammatory state. This mild inflammatory state causes frailty, which is called weakness. And frailty is very dynamic. Frailty can be modified. You can be extremely frail and again come back to being non-frail. So how do we do it? Okay. So if as you grow old, there the role of vaccine comes into play. You have to take these vaccines if you're above 65 and you have either of diabetes, hypertension, lung infection, something called a COPD, or have uh, thyroid or have been repeatedly hospitalized. What does this vaccine do? The vaccine does the same thing which you experience when you are young, when you are adults, and when you get an infection. They trigger your immune system to again make specialized cells to fight against any of these infection which going to trouble you going ahead. So a shingles vaccine, which is the chickenpox, which we all know, if chickenpox in the senior age group happen, is going to trouble you a lot. The chickenpox pneumonia is also sometimes very critical. Flu vaccine every year, it is a necessity at present, especially after COVID-19. Tdap, it is the tetanus vaccine which you should take every 10 years, especially in an Indian setup. And in the nutrition support, vitamin E in the form of supplements, it is a good anti-inflammatory property and it will help you to keep the inflammatory state of your body a little subdued as compared to without supplementation. So that's it, sir, from my end. I hope any questions, I'll be more than
Yes.
happy to end.
Thank you very much. Thank you very much for an amazing presentation. And if I might add, a good looking presentation. We have a few questions that have come in, if you don't mind,
Yeah.
Vinay. So this is from Satish Kate. Um, okay, so let me get on to the first one. The Kamlesh Vajpayee, he's 72, 51 kgs. He has high BP. What range of BP is normal for him? He says he takes Allmat 40 and a beta blocker in the evening. His HbA1c is 6.75, and he walks slowly 40 minutes a day. His HDL, he says, is 69, and he's asking whether is it bad, and is there any word of advice that you would like to give him?
And I believe so. The HDL value is wrong. It can't be 69. It's too high. It has to be around 50. So I'll give you as a general answer for all the people here. The four parameters you have to know it, learn by heart. First, your blood pressure has to be 130 by 80. And if you can write it down, this is the key to a good health overall, irrespective of your age. So a blood pressure of 130 by 80. Second, your pulse rate ranging between 60 to 80. Third, your LDL cholesterol ranging from 50 to 75. LDL, Lucknow, Delhi, Lucknow. It's not HDL, LDL. And fourth, HbA1c, which is your marker for sugar, less than 6.5%. You follow these four parameters in your blood annually, you're going to have a supreme health, irrespective, cardiac wise, blood pressure wise. Rest, physical injuries because of your activities and active livelihood, that is excluded.
Right, thank you. We have a question from Anita Rakshit, who asks, does ashwagandha and telmikind go together?
Again, ma'am, ashwagandha, telmikind is not metabolized by more by the liver. So yes, you can take it hand in hand. That's not a problem. Especially ashwagandha and blood thinners and digoxin are more interactive medicines. So yes, you can have it together. Not a problem.
But so tell me, doctor, if one does want to have ashwagandha, would you are you saying that one should, have it only by consulting your doctor?
Yes, the synergistic. That's the only thing. Ayurveda medicine. They again, you have to break that myth. Ayurveda is equal to safe. No, it is not. Rather, anything in excess or is unsafe. Anything in poison. Let alone it be water. If you're going to consuming 4 to 5 liters of water a day, it is going to be dangerous. So if you're going to take Ayurvedic medicines which have the same active molecule component, eventually all these are active molecule chemical components, and having the same medicine as an allopathy, they both have the same active molecule component acting on the same receptor, you're going to cause a synergistic effect of the medicine, and that becomes detrimental, right?
Yeah. Although this has not been asked, but any word on homeopathy?
So my experiences with homeopathy, like I've not studied it, so I really have. So the only thing I believe is, there's no offense to any branch, but I've not had experiences with homeopathy with the patient. Where most of my patients come with Ayurvedic medicine. I told you the Indian senior citizens are more pro towards Ayurveda. But the only country where homeopathy was born, that was Germany. I think even they have stopped homeopathy as medications. They have stopped it.
We have a question from Sunita Verma, who says, who's 68, and she says her triglyceride are 171. Is it
Too high.
dangerous?
Yeah, 171 is high. But I think she might be diabetic also. Can you ask if she's diabetic?
Sunita ji, are you diabetic? Well, we'll wait for her to reply.
Yeah.
But in the meantime, we have, okay, one second. I think she has the. In the meantime, I'll take another question, which is from Satish Kalia, who's 80. HDL is 60.7, LDL is 45.7. Is that okay, or should he take medication? And secondly, he is taking Artovisrin 16 Should he continue or stop? Um, uh, Folks, do note that while you're asking specific questions here, this sessions like these online are only advisory in nature. So
Yeah,
even if I know we are putting Dr. Patankar in a spot by asking these questions, but do note that you should be asking these questions to your physician, to your cardiologist, etc., because only she or he could actually look at your
yes.
specific case and address it. So I think I'm going to avoid this question, but just the first part. uh, M80, 80 years old, 60.7 HDL, LDL 45.7. Is that okay, or does he need to take medication?
That's fantastic.
That's fantastic.
He's taking atorvastatin.
Yeah,
60. Yeah. You should continue. It is because you have been taking, it's equivalent to you were studying 18 hours, that's your ranking first.
right. Uh,
So there's one good question, sir, I've got here. The levels which doctors have mentioned are with or without medication. Okay, this is by Satish Kalia.
right.
What I mentioned at 4 points is you take the medicines or you don't take the medicines, you have to maintain these levels. So if you're not able to maintain it, you take the medicines. That's it.
Right. We have a question, interesting question from Bomi, who asks, is low BP a cause of falling in seniors? Is there a
Yes.
medicine to control low BP?
First slide, controlling hypertension, the biggest challenge is we have to go slow and we have to go low. We cannot start them medicines rapidly because the fall in BP is going to call fall. They're going to have a fall, and that fall can be detrimental if they have a fracture. So, is there a medicine to control low blood pressure? Yes, there are, but they have to be monitored. So you cannot prescribe them over the counter, and it is not kind of a safe medicine because it can cause shooting very high blood pressures also. It's always better you start medicines for controlling low blood pressure. There are, but it has to be with the monitoring and consult of a cardiologist.
Right. Sunita ji, who had asked a question earlier, she says
Yeah, she is coming pre-diabetic.
her triglyceride, and she is 5.8, so she's has an amazing count. So I think Sunita ji, the mango season
Get
is coming. Mango
yeah,
season is coming
Sunita.
in Baroda,
Yeah,
so you can go ahead and enjoy yourself. uh, we have a question from Meena Goel, who's 68, 61 kgs. She has high BP. Um, uh, she walks slowly 40 minutes daily, and she's a sugar patient also as well. You know, what high BP range should she have is a question. I think you answered that. Uh,
that four, classic four. You write it down. That's a key to good health, especially good cardiac health.
right. Uh, this is Hina Mehta. My age is 59. She's not yet a senior. Some allopathic medicine for cough and cold, in which some content is a cause of increasing blood pressure. Is that true?
Unlikely.
Right. We have a question from Manju Agarwal, who's 70, and she takes Tell Me 20 since 5 years. But this time my creatinine is 1.72. Is that okay?
So I think you should go to your cardiologist because, okay, so tell me certain, which is tell me 20 is a low dose, but rising creatinine with the age of 70, I think we should shift the medicine or rescreen your creatinine or see how the trends are. If your baseline is going to be 1.7 or 1.6 or 1.5, then it's okay. It has to increase 30% from your baseline. So the baseline is important. As you grow, the baseline is important.
Uh, Sunita Verma, who had asked about triglycerides, she said, HbA1c is 5.8. Should she start taking medicines for her triglyceride? Uh,
She can try
she
avoiding sugar, sir, for the next 3 months, and her triglycerides might come down.
Now, it's interesting that you mentioned about sugars. Now, can we define sugars? Is good sugar is good sugar thing? Is Are dates sugar? The anjeer, dried anjeer that you get, are they all sugar, or are they
Yes,
same?
all sugars. Anything which touches sweet to your tongue is sugar. Now, okay, one more thing sir, about how people have ashwagandha and the turmeric and the garlic. The one thing they have is white refined sugar is bad, but jaggery is good. No, When you process jaggery, you make refined sugar. They both are same chemically. Your body does not know you're taking jaggery or white refined sugar. For it, the both are carbohydrates. So that is one myth. If you're going to take jaggery as a replacement for sugar, you're doing no good. It's going to harm you. Same is with anjeer, same is with dried the raisins and all.
Now, doctor, this is a very funny question that I've got on WhatsApp. It says, doctor, my blood pressure is borderline, but every time I watch some web series on the various platforms, he's given the names of the platforms also, but I'll avoid them. I find that my blood pressure goes up. What should I do?
Depends if the web series is going to be intense, your blood pressure spiking is accepted. But again, if you want to get rid of your, there is a solution to this also. If you want to get rid that, do you have blood pressure or no? Something called as ambulatory blood pressure monitoring. So it's a device which is attached to your forearm arm. It stays with you for 24 hours, monitors all your BP every 15 minutes for the next 24 hours. You do your all routine, you go to your office, you do all your routine life. At the end of 24 hour, it gives you a PDF format. In that PDF format, it tells you how many hours or how many minutes of the day you were in hypertensive zone and how many you were in the normotensive zone. And it gives you the burden. So if more than 10% burden, it's like if more than 2 hours over the next last 24 hours you were a hypertensive, then yes, you do need medicines. That is one test which will sort out, do you occasionally get spikes, or are you hypertensive, or you're masked?
And how does one do this test?
It's a home care test. You don't have to go to anywhere. You just call up people who do ambulatory blood pressure monitoring. You can write it down. A, ambulatory, BP, which is blood pressure, M, ambulatory blood pressure monitoring. So
So is it
any service
like the
provider in your
is it like the
city,
CGM which is there? The
kind of a CGM. Yes, it is a CGM for blood pressure.
right. And what is the approximate cost of this?
Comes around 4,000 to 5,000 depending on the service provider. But it's worth the investment. It's really worth the investment. It just rules out are you hypertensive or not,
Great.
rather than guesswork.
I'll just ask a few questions. I know we are at 5:40. Paranjit Kaur says she's having cough. It's not going. She's 73. I know it's not a BP hypertension related question, but still, since you're here,
Uh, yeah, I know. Paramjit ji, madam, if at 73, long-standing cough, please get a 2D echo done. Just let's rule out it is not the heart which is troubling you.
right.
Even if you're not blood pressure, not having, just get a 2D echo done. That's the most important thing at present.
Yeah, thanks. Mr. Jambunathan, who's 77 with BP levels 140/75, with medications of 20 mg of Almighty, is it okay?
Preferably 130, sir, but at the age of 77, it's okay. Again, I don't want to aggressively make it down so that you feel giddy and have a fall. So yeah, that's okay.
Right. Hina Mehta asks, natural sugar is good like khajur.
Again, khajur is also sugar. The
Great.
worst fruit, I'm telling you, sir, it's watermelon. People think it is just rich in sugars. It has the highest glycemic index. So people who are diabetic should not at all touch watermelons at all. Because summers are coming, I'm going to tell you that.
Summers are coming. Summers are coming. It's mango season, and and of course also watermelon. Thank you very much, Doctor, for this excellent session and for answering quite a few questions that are there. You know, as you know, we've got quite a few questions. Some of them very direct questions about medicines, etc. But you have addressed them all, and I'm sure people have benefited a fair bit as well. To all of you here, remember this is a session that is advisory in nature. So do consult your doctor in person. You can, of course, also meet Dr. Kunal Patankar or refer to him or contact him. And his hospital is a Dadar. It's an amazing place. You get amazing fried food near his hospital. But that part, it's do remember that this is advisory in nature. We will have our sessions on Health Live once again next week. Next Saturday, we have a special session from a senior vascular surgeon from Kokila Ben Hospital, who's going to be talking about diabetic foot. So do remember that. And before you leave, doctor, I'm going to just request our producer to play a video of our latest issue of Seniors Today, which was out on the 15th. And this is So it's a love special. I would say a lovely issue, but
Yeah, I know.
there's some pain as well. And as you know, all of you, that the magazine is available free of cost. It's available online on the Seniors Today website, that is seniorstoday.in. Do remember that we have a host of sessions on our Evergreen Club, around 15 to 20 of them every week. So don't download that, and see you next week on the Health Live session. And
So
thank
before we leave, like, you remember before we joined live, we had come across the normal thinking tendency that am I a burden? And we did not talk on it. And I just recollect it.
right.
So
Yes.
yes, aging is not a burden. Obviously, health is equal to independence, but simply this is, and that's a very true problem. So people just say, "Yeah, I'm 75, I've lived enough, 80, I've lived enough." No, absolutely not. If you're active, you're fit, you're mentally, you're not a burden to anyone. And if you think you're a burden to your children's, remember, you never thought them as a burden when you were wiping their potty. So at present, if they're going to do things for you, it is their kartavya rather than a work काम. So that is what I tell my patients. Do not feel that वो उनका कर्तव्य काम नहीं है, so they should not be burdened by it. And eventually, you have to take good care of your health, and that will give you independence by default. So do not delay seeking doctor's help. That is what I will tell. As you age, you have to accept your vessel is growing old, the spare parts are becoming bad. Just go get it treated. No, why you want to wait until it becomes really untreatable?
I'll tell you, doctor, the reason why this is there is also because it's fairly expensive these days. Medical care is exceedingly expensive, and not everybody is enlightened enough to have got very good medical insurance. In any case,
Yeah,
OPD care is not really covered by medical insurance. So I think
yeah.
one of the big problems why people do delay is because, yes, it
The
costs
cost.
money.
Yeah,
So, well, this is I guess we really have no solution to it, except that, of course, medical care is becoming, a lot of it is available, which is cheaper now, and it is more freely available. So all the best to you, doctor, and to
yeah.
the
Thank you
entire
so much, sir.
community.
Thank you so much for the opportunity.
Thank you very much,
Thank you.
and see you all next